Hello, my name is Michael Zimmermann and I'm doing my capstone presentation on a mixed method analysis investigating the perception of healthcare professionals regarding stem cell treatment for hemipoietic malignancies. This paper analyzes how healthcare professionals perceive the use of stem cell transplants to treat blood cancer patients. The rapid increase of hemipoietic malignancies over the last decade emphasizes the need for effective treatment options to be evaluated. The purpose of the study is to provide a qualitative, comprehensive overview of how stem cell transplants are perceived for treating hemipoietic malignancies. Regarding the literature review, SCT is found to be an effective form of treatment for various types of blood cancer. ASCT showed significantly improved time to disease progression compared to cyclophosphamide in relapsed multiple myeloma patients. ASCT in AML patients 65 and older have found the treatment to be safe and effective, showing positive survival rates and progression-free survival. However, there are differing views among healthcare professionals that reflect the ongoing debate about stem cell therapy in treating blood cancer. Jin et al. Found that CD19-directed CAR T therapy was more effective than HCT alone in treating B-cell acute lymphoblastic leukemia, and Borenhauser et al. Concluded that allogenic stem cell transplantation was not superior to chemotherapy for intermediate risk AML patients. It is important that the patient's needs are addressed and that social and financial support is available. Solanki et al. Studied patient experiences before undergoing HSCT, finding that understanding pre-transplant experiences is crucial for better counseling and support. Continuing on to the methodology, the research design of this study was a mixed method analysis used to investigate the perception of healthcare professionals regarding stem cell treatment for hemipoietic malignancies. For the setting in participants have either received and/or are pursuing a graduate degree, master's or doctoral, in medicine, the human sciences, or healthcare. The research question that is being evaluated is what is the perception of healthcare professionals regarding stem cell transplants for blood cancer? The method and data collection procedures. Each participant was recruited through means of direct emailing or by advertising on social media sites such as Instagram or Facebook, and through QR codes. The limitations of this study. A small sample size and low response rate limits the generalizability of the study. The research is also limited by participants' level of knowledge within the area of study. The first major finding after completing the study is that healthcare professionals view stem cell transplants as an effective treatment method for blood cancer. This is true as 56% of the participants strongly agreed, while 19% of the participants somewhat agreed that SCT is an effective treatment method. The second major finding is that healthcare professionals believe that undergoing SCT will not decrease the quality of life for blood cancer patients. The mean score for this statement was a perfect 4.0 for somewhat disagree, and the majority, 54% of the participants, somewhat disagreed with this notion. The third major finding is that healthcare professionals view immune rejection as the most serious health risk associated with SCT treatment. Every participant who agreed with statement number 4 selected immune rejection as an associated health risk. Social acceptance is a major challenge that limits stem cells from being utilized in common practice and in a clinical setting for treating blood cancer. This stems from stigma and misinformation, which is a common subtheme found amongst 2 of the free response questions in the survey. Social and financial support are also perceived to be major obstacles and challenges surrounding the SCT treatment. Overall, healthcare professionals have a positive perception regarding the effectiveness of SCT treating blood cancers. However, healthcare professionals also acknowledge the serious health complication associated with the treatment as well. As scientific research progresses, SCT is becoming a more competitive treatment option for patients with blood cancer. Based on the literature review and this study, healthcare professionals generally accept stem cell therapy as an effective treatment for blood cancer. However, they consider risks like GVHD and immune rejection before recommending it. It is crucial to take these factors into account when making conclusions. A challenge that was encountered during the study was a lack of participant knowledge, which affected the credibility of the research, particularly in the qualitative portion where there were fewer and often inaccurate responses. To address this, I recommend stronger verification questions and ensuring that healthcare professionals with relevant knowledge take the survey. In future studies, building better connections with healthcare professionals and directly contacting oncologists and stem cell specialists could improve participation. This research has implications for patient care, as SCT is already in use for blood cancers, and it may be proposed more frequently as perspectives shift and as it is adopted earlier in treatment protocol. However, healthcare providers must consider the ethical implications, particularly the health risks, such as immune rejection. Personally, as someone who has lost family members to cancer, I've always been drawn to oncological research. Although my experiential learning hours at the dog boarding facility didn't directly connect me to this field, I've been able to network with healthcare professionals who have helped me with my survey. By advertising through flyers and email, I have leveraged these connections to gather valuable data for the survey.